Volunteers in Medicine is a free clinic for the working uninsured in Jacksonville, Florida. We utilize 300 volunteers a month to provide primary care and specialty care. That is what we do with our staff and our volunteers. We do so much more with the help of our partners in our community. We cannot do this work alone. We utilize the strengths of our partners with a guided mission to impact our community in a positive way.
Volunteers in Medicine has helped me improve my health in many ways, and first and foremost, my diabetes is now under control. I've seen a podiatrist about my feet because with diabetes you get nerve damage, and so Nina was really concerned to make sure that my feet were in working order and there was nothing really going on there. I was at an 11.2 with my glucose, and I am now at a 6.2, so I'm technically pre-diabetic now, and that is mainly due to the help I received here. It makes me feel like something I've never felt before. You know, it's so amazing. I feel proud. I've always struggled with my health, and to be able to sit down, go through the hard truths of what's happening in my body and what I need to do to get my life on track, because that's a high number to have for your glucose. So what happens after that? And so this is life-changing. It really is life-changing. So I can't really put it into words how I feel, because I'm kind of a new person now, you know, and it's thanks to Volunteers in Medicine.
For more than 30 years, We Care Jax has served as the specialty network for the safety net in our community. We work with 13 safety net free and charitable clinic partners who do primary care, and when their patients need advanced specialty support, that includes advanced diagnostics, visits with specialists like cardiologists and pulmonologists and oncologists, our network refers those patients to us, and we ensure that they get the care they need at no cost to the patient or their family. The specialists who work with us, they are all physician volunteers. We have a group of more than 500 who have said, yes, I will take a patient and I will not charge them for that visit. Our role as the We Care Jax Specialty Network is to ensure we're putting that patient case together for the physician with all the laboratory reports, all the imaging that they need to use their expertise to the highest possible good.
Tuve un tratamiento el año pasado que fue aproximadamente por 1 año y 2 meses. Tuve un problema de salud referente a una bacteria que se desarrolló en mi cuerpo, y los doctores estuvieron pendientes de las enfermedades también, y hasta el momento ya han sido 4 meses que ya tengo buenos resultados referente a eso. Ya no tengo la bacteria, el virus que te presentaba el año pasado. The yoga class in volunteer is a lot of warming stuff. People the different ages coming here to participate, as well the coach that give the class for for yoga class. She's well known about what we need to do, what the process. You also keep in mind the ages of each person who participate, from the younger to the more senior person. The impact I had with me when I be part of those classes, especially the yoga class so far, it's been to feel more relaxed and kind of more start developing more flexibility, and also the tension that the body has, it's been released, and learning how to kind of work it out. Even if you're not coming to the class, do a practice at home, some of the exercise that I remember for the yoga.
Currently, we provide yoga at the clinic on Saturday mornings, and it's open to the community and members of the clinic. Participating in a yoga class can be beneficial because some people might be dealing with physical pain or other health conditions. So the physical aspects of the yoga practice can help them improve their strength and their flexibility. It can also help them alleviate the stress associated with those. And we also provide a curriculum component, so we encourage individuals to work on themes throughout class, so things like emotional awareness and regulation, self-care, recovery. So those are things that they'll benefit from in the practice itself, as well as their learning tools to bring with them when they leave class as well.
I don't know how to put it into words. It's just when I partnered with Volunteers in Medicine, right off the bat, everything I needed help with medical-wise, the needs were met, and I've been more healthier since. The food pantry portion of Volunteers in Medicine came about. We used to have group sessions, and I met a lot of people who could relate to me and I could relate to them. We bounced off a lot of ideas, Then they would have the truck that came out and you could come and get your groceries. And it really helped with keeping with nutrition and just interacting with that nutrition part. I never been to a nutritionist before that. It's helped me with my medical issues, my weight. So it has really helped me to be able to stay on task, and it helps me to be conscious of what I eat. Not saying I don't eat wrong, but it just helps me to be a little bit more better because, hey, I have my cheat days. I'm a girl, so sue me.
Feeding Northeast Florida is a regional food bank covering Northeast Florida and North Central Florida. We look for ways to lift up the people that we're serving. And it's not enough just to provide food, but looking for ways that we can improve health outcomes. So we look at everything through the lens of nutrition alongside food distribution. And it's really been effective for us to work with our healthcare providers, specifically our federally qualified health clinics and free and charitable system here in Jacksonville. Volunteers in Medicine is probably one of the most outstanding partners we have, in that their efforts to make their patients healthier align so much with the work that we're trying to do. So the provision of healthy food to them, where they then monitor the health outcomes of their patients, is just a perfect symbiotic relationship where we're doing what we do best, which is to acquire and distribute food, and they are doing what they do extraordinarily well, which is to improve the health of their patients.
Partnerships are critical. We cannot do this work alone, none of us, absolutely none of us. We are a big healthcare organization. We've got 15,000 team members. Baptist and Volunteers in Medicine partner together to make sure that everyone in our community can be served with healthcare. And that includes mental, physical, clinical, and nutritional health. And so that is how we partner. We have things that we can do inside of our walls. Volunteers in Medicine has things that they can do inside of their walls. And so we partner to make sure that every community member has access.
Partnerships can be fundamental to what you're doing as an organization. If you can get your missions to align, you can work with partners on a number of issues. If a partner is here, for example, Volunteers in Medicine, and they have an issue on the other side of the hallway, because as you know, we have our 6 dental operatories and our 6 medical exam rooms on the other side of the building. If they need service, that's an in-house direct referral into our dental program.
I really appreciate everybody who has stepped up for me. And it has really, just always nice when you come in. I really appreciate it. And I thank them so much.
Bueno, me gustaría agradecerle a Volunteer in Medicine por permitirme ser parte de la familia, también a los doctores y a las enfermeras, un gran equipo que tiene Volunteer in Medicine, que todo envuelve toda la familia de los pacientes, y también a la oportunidad que da en la parte recreativa, no solamente a la parte de salud, sino también a la parte recreativa del arte y la formalización de las clases que dan los fines de semana, que es yoga y tai chi.
I want to thank everybody at Volunteers in Medicine. Literally everybody. They've all been like amazing to me, and I can't just thank one or two people. It's literally everybody here.